Good morning, everyone. Thank you all for joining us for our webinar today, Silica General Industry Regulations. It's not just a construction problem. Presenting today will be Forensic Analytical's very own Director of Environmental Health Services, Michelle Rosales. Michelle has her master's in public health and is a certified industrial hygienist out of our Los Angeles area office. She's got over 18 years of experience throughout California and the United States, and she's managed hundreds of investigations involving a variety of physical, chemical, and biological hazards in various community settings. Michelle specializes in occupational and environmental exposure assessments, wildfire smoke assessments, and indoor environmental air quality evaluations. She's a nationally recognized expert who has presented on these technical topics at many different conferences and symposia throughout the country. So before I hand it off to Michelle, I'd like to quickly cover just a few components of the webinar platform we're using today, GoToWebinar. Every attendee is in listen-only mode, but this does not mean that we cannot communicate with you. As you think of questions that you have for Michelle throughout the webinar, please enter them in the question box in your control panel on your screen. You'll see the little question icon there on the screen and type your question into that box and choose send question to staff, send, and we'll cover those during the question and answer session at the conclusion of the presentation. So with that, I'll hand it off to Michelle.
Thank you, Taylor. Thank you everyone for attending today. The presentation of Silica General Industry Regulations is not just a construction problem. We've been talking about silica for a while now, so it's important to kind of highlight once again the general industry regulations and some of the most recent developments associated with it and the cases of silicosis. So for today's webinar, I will begin with a brief history of silica and exposures, as well as the health effects associated with silica exposures, going into understanding the standard, some of the differences between the general industry standard and the construction standard, as well as case studies, because everyone loves a case study. So, we do environmental consulting. So some of the exposure assessments that FACTS has been involved with that kind of highlights when you use engineering and work practice controls, what you see in terms of reduction of exposures to individuals, which is very important. So I can't talk about silica without talking about hawk's nest. Silica, the health effects associated with silica have been known throughout the years. However, really wasn't highlighted as much as it should be until 1930. And what happened was in West Virginia, they had hawk nest tunnel, which was being built, and several workers were pulverizing this rock trying to get the tunnel to go through. And some of this rock contained as high as 99% of silica in it. And obviously at this time, we didn't have OSHA yet. So by the time the work ended, over 476 workers had died of silicosis. And it was estimated that 1,500 developed this disease within a year or two. So they had high acute exposures to silica. And it's also stated that this probably is a large underestimate of what happened in terms of exposures to individuals and the health effects during and after the tunnel was built. But it kind of highlighted the importance of using engineering controls and respiratory protection, because individuals were not wearing respirators when doing this work. So it was a pivotal moment in silica, as well as just general industrial hygiene's history. And so yeah, that happened right in 1930. And so in 2016, OSHA revised the silica standard. It became in effect on October 17, 2016. And OSHA began enforcement of the standard for construction in 2017 and enforcement for general industry in 2018. But I myself have done a lot of presentations on silica, and this is actually my first general industry presentation, because a lot of the focus has been on construction, because that's where we know there's a lot of exposure issues where people are working with concrete materials, pulverizing it, putting in these small particulates for exposure. And so a lot of focus has been on the construction industry itself. And although there is a standard associated with general industry, we really didn't see a lot of news or discussions on it. But a recent colleague had sent in an article that recently was in the Los Angeles Times, and this article was dated September 24th, 2023, and that kind of sparked this presentation where it kind of discussed the number of individuals in general industry dying of silicosis and other silica-related health issues. This specific article talked about California itself, and it talks about fabrication workers and the development of silicosis within these really young fabrication workers. It's not the 60-year-olds or 70-year-olds with chronic exposures getting silicosis, but now men in their 20s and 30s. And silicosis is an incurable disease, and it can kill someone, cause people to potentially have lung transplants, and it's a very debilitating disease itself. And within this article, they talked about a study that was done in July 2023 by the American Medical Association that discussed in an article called Silicosis Among Immigrant Engineered Stone Countertop Fabrication Workers in California. And the study cited 52 males, patients that were diagnosed with silicosis caused by occupational exposure to respirable silica dust from this engineered stone. And of those 52 patients, 20 suffered from progressive massive fibrosis, 11 needed lung transplants, and 10 died due to their exposures. So it continues to be an issue even after this 2016 standard was revised. You think this day and age people have an understanding of health and how to reduce exposures to employees and workers, but as we're seeing, it continues to be an issue, and maybe to different working class groups as well. And what was also interesting about that article, it talked about, within that American Medical Association study, that after the fact, these 52 male patients, 25 of them continued to fabricate stone after being diagnosed with silicosis. So it just kind of highlighted to me how important it is to kind of bring the awareness to the general industry on silica exposures and how to protect workers. Along with that article, when I kind of dived a little bit deeper, I saw that Cal OSHA had recently sent out, with the California Department of Public Health, sent out this employer requirement to various industries and facilities. And it stated within the specific documents that it has been identified your facility as one in which employers may be exposed to silica dust due to their work with natural or engineered stone countertops. So within that, they've sent out documents to various companies saying, hey, we know there is an issue with exposures to stone fabrication workers, and you need to make sure that you're doing XYZ, meeting the standard. Have you performed your exposure assessment? And we'll go into the specifics a little bit later in the presentation. But along with that, contacting the employers themselves, there's been an initiative to educate workers themselves. So going out to these locations and providing documents that you see here on the hazards associated with their work, letting them know, hey, you could be exposed to silica. And with that comes potential diagnosis of silicosis, and that your employer is required to try to protect you from these specific exposures. And there is actually a Cal OSHA special emphasis program trying to educate and protect those workers. And it's called the California Artificial Stone and Silicosis Project. But I'm not going to be just focusing on stone fabrication workers. General industry obviously encompasses various others. So when I talk about the case studies, it will go over fabrication workers, but there'll be other ones that you would be surprised to hear of. So let's begin with what is the exposure issue. What is silica, right? Well, you probably aren't surprised to know that silica is one of the most common minerals in the Earth's crust. So think about it, it's sand, it's all of these different materials that make up the Earth's crust. And so there's a lot of it. And there are two different forms of silica. There is crystalline, and then there's a non-crystalline. So the non-crystalline is found in glass, silicone, and these tend to be less hazardous to the lungs. When we're talking about the regulations, we're talking about the crystalline version of silica. And there are various forms of crystalline silica. The three I have highlighted here are the most common. So I'm sure you've heard of quartz. Sometimes they use silica and the word quartz simultaneously. There's also cristobalite and tridymite. And quartz, cristobalite, and tridymite are the ones in the regulations, the three forms of silica that we're looking at. And when we're talking about quartz, it's the alpha quartz that we're typically looking at as well. So where can we find it? Again, it's one of the most common minerals in the Earth's crust, so it's everywhere, but we find it in sand. So when you go to the beach, that's silica. It's in soil and rock, gravel, sandstone, slate, granite, clay. It's everywhere. When I do exposure assessments and someone hands me a safety data sheet to review a product to kind of develop my sampling plan, probably at least 50% of the time, even when it's just a product you wouldn't think of containing silica, it contains silica, at least trace amounts of it. So it's pretty much ubiquitous, I would say, at this point in materials. And again, we go to the beach all the time, right? If maybe I'm on the West Coast, so I'm assuming a lot of people might be on this, but you might not. But if you go to the beach, you're in front of silica, right? You're being exposed to it, but is it harmful? And the answer is no, not if it's in that size fraction. What we're worried about is the really small pieces of silica that are small enough to go in, to be inhaled, and travel all the way down to the lungs themselves. So this, again, if you're just holding sand, it's not an issue, but let's say it's in, silica is in concrete. If you're pulverizing it, if you're jackhammering it, if you're doing mechanical work to it, you're creating a really small size fraction of the silica particulate itself. And that has the ability to go into the respiratory system and get down to the lungs. So again, silica, in terms of sand, it wouldn't go far. It'd probably get up to your nose and stop right about there. But we're talking about the size fraction that's small enough. And to put it in perspective, right here, you can see this nice photo here that shows you a fine beach sand. It's 90 microns in diameter, and that's not what we're talking about. That's a larger size. We're talking about the really small size fraction, maybe this PM 2.5 here, that can get low, again, get small enough and get through the respiratory section of the respiratory system, the lungs. And then look right here, your hair, just think about the size of your hair. That's 50 to 70 microns. So really, really small particulates is what we're worried about. I say it's ubiquitous it's everywhere, but we're talking about, again, the small sizes and a specific concentration. So what industries are we really worried about in terms of exposures? Well, as I alluded to at the previous slides, it's the engineered stone fabrication. This is probably one of the most dangerous kinds of countertop, the engineered stone, also known as quartz, again, silica. And it has much more silica than any other type of countertop. So people working with engineered stone fabrication have high exposures. Concrete mixing and cutting, that tends to be more of the construction side of work. Sandblasting in general industry, a lot of people sandblast still with silica containing material. Brick and stone cutting, foundry, mining, fracking, pottery manufacturing, believe it or not. We've done exposure assessments for silica with EVS or custodial staff when they're doing deep cleaning of ceramic departments at school. And there are measurable levels of silica found in these types of work operations. So it's kind of stopping and thinking about where is their silica and where could be their potential exposures. And there's a lot of this. So why are we here? Why is it harmful to you? Well, it causes silicosis. And the problem with silicosis is, one, it is uncurable. And a lot of the times you can develop silicosis without developing symptoms up front. Until by the time you maybe have an x-ray or start to feel issues with your respiratory system in terms of harder breathing, it's too late at that point. Some of the symptoms that might occur are shortness of breath, coughing. As I said, the dust gets down into that respiratory system all the way down to the lungs, and it can cause fibrous scar tissue, which you'll see as nodules on this x-ray here, is very debilitating, and it can be fatal. And there's 3 different types of exposures that we talk about with silicosis. There is a chronic exposure, which would be where there's a latency period where you really won't see anything for at least more than 10 years. And it's really small chronic exposures, low exposures happening through some, greater than 10 years of someone's work span. And with that, the severity of the illness it's highly variable. It might be very mild, or it can be very severe. The next is accelerated, where you have this latency period of 5 to 10 years, and you have higher exposures. So you're not getting those really small chronics, a little bit higher. And now your severity of the illness is same thing as variable, but often you're more on the severe side. So your lungs aren't getting a chance to repair, try to kick out the dust if it can. So you see these more severe health effects associated with it. And then there's the acute. And so we have a latency period of just weeks to months where someone develops silicosis. And with this high exposures, it has this severe morbidity, and the mortality rates are very common. So when we're talking about the hawk nest issue, those were definitely acute exposure. So within the time frame that they're creating this tunnel, individuals are dying from these high exposures and developing silicosis within that time frame of the work being performed. But not only is there silicosis to worry about, there's other diseases that are associated with silica exposures. There's chronic obstructive pulmonary disease. Workers exposed to silica are those who have silicosis are also at increased risk of tuberculosis, which is a contagious and potentially life-threatening infection. Individuals can also have lung cancer, kidney disease. It's also associated with autoimmune diseases such as rheumatoid arthritis and scleroderma. So now that we know it's harmful, we know there's a big push to try to prevent this, what standards and regulations do we have that are trying to accomplish it? So when we're thinking about OSHA, we have our airborne contaminant list, which is just that list that we look at that shows what are the permissible exposure limits associated with that specific contaminants. We can look at that. There's also the construction standard that's specific to those in the construction industries and way to reduce exposures. And there's also general industry and maritime. So the construction worker only applies to construction, although some people in general industry may do portions of that work at different times of their work schedule. But general standard applies to occupational exposure. Sorry, my PowerPoint might turn off here. I just had a, oops, sorry, one moment. It just kicked me out. Hold on one moment.
Let me know if I can share my screen too, Michelle.
Have it. Sorry, that was, it started to think. Okay, hold on. Okay, do we see it now? I apologize.
Perfect.
Apologies. Okay, so general industry applies to all occupational exposures except the construction workers, agriculture workers, and exposures from the processing of sorbent clays. So we have these 3 different regulations. We're going to be talking about general industry specifically, right? So in 2006, as I previously stated, OSHA issued a final rule to protect workers from exposure to respirable crystalline silica. They put out the new standard, and then they said, okay, you've got a year to get it together, figure out, we know that we've put these new implementations of exposure controls that are necessary, reduced exposure limits. We'll give you a year, and if you're in the construction industry, before we begin enforcement of the standard. General industry got 2 years. So in June 2018, OSHA began enforcement of this standard. And with that, the biggest ones were the reduction of the permissible exposure limit and the development of an action level. So previously, federal OSHA had this funky calculation that you had to do in terms of determining what your permissible exposure limit was. So what they looked was you measure the amount of respirable dust, and then if you knew what the percentage of it was composed of silica, you multiplied it by this and that, and then you got exposure limit. California kind of had it a little bit differently, where they gave you a specific value. They just gave you a specific number, but they also had total silica as well as respirable silica. And they squashed all that and said, okay, we're just going to give you a value. And the permissible exposure limit was 50 micrograms per cubic meter, which was significantly lower than the calculations. So that's a really low number, 50 micrograms. But along with that, again, they now established an action level that said, when you hit this number of 25 micrograms per cubic meter in an 8-hour workday, you now have to start doing X, Y, Z. So it's not requiring, respiratory protection like you would when you go above the PEL, but now you have to start implementing medical surveillance, and I'll go into it, and a lot of different things. So that was the biggest change. And there's a big difference between the construction industry and the general industry as well. The construction industry standard, if anyone's familiar with it, has this nice little table where they kind of remove the idea that you have to do exposure assessments. It just says, if you're going to do these type of work practices with these controls, this is the level of PPE you need, and don't require exposure assessments occur. General industry doesn't have that because it's such a broad group of individuals and broad amount of different type of work being performed. So they do require exposure assessments or objective data. However, despite the fact that this, started in 2016 and in 2018 became enforceable in general industry, OSHA still estimates that over 100,000 workers in general industry and maritime are exposed to silica levels that exceed this new permissible exposure limit. So that just shows you that even putting out the standard, there still needs to be more awareness and education to individuals of the potential hazard, as well as how to protect individuals from exposures to silica. So one of the parts of the standard in general industry, again, talks about the exposure assessment, and they kind of go about it 2 different ways. They say you could use the performance option or the scheduled monitoring option. Because we want to see what is the exposure to these individuals. If it's greater than the action level, again, they have to start implementing controls and a bunch of different other requirements within the standard. If they are above the permissible exposure limits, there's even more requirements associated with it. So in order to do this, you've got to perform an assessment, or we have the number 1 is a performance option. So that gives employers flexibility to determine the 8-hour time-weighted average for each employee based on a combination of air monitoring data that they collect themselves and the use of objective data. And so what that is, the objective data is looking at data that is most reflective of work conditions at your site without you actually doing the work. So examples can be air monitoring data from industry-wide surveys, calculations based on the composition of a substance. You can do area sampling results or historical air monitoring data collected by the employer. So you've got information from way back when, so you don't necessarily need, nothing has changed, so you can still use that data. Within general industry, I tried to do a little research to see if they've got a lot of that industry data available, and it's not as robust as it is for construction. You can Google construction objective data Silica, and there's a few websites that go over if you're jackhammering and this is happening, they'll have data for you that's available. So you can use that if you're maybe a smaller business and don't have the funds to perform your own exposure assessments. But if you're going to use this performance option, there's a lot of different documentation that you're going to need to provide, and I'll go into that in the record keeping section of this presentation to kind of show what you're using and whether or not it is truly reflective of your data or your situations. The second option is a schedule monitoring option, and that's your traditional industrial hygiene exposure assessment. So performing your initial air monitoring. If you have an exposure of an individual greater than the PEL, then you're going to have to continue monitoring every 3 months. If it's greater than the action level, you're monitoring every 6 months. If it's less than the action level, you can discontinue unless there are any changes to work practices, controls, etc. Additionally, there are regulated areas that are required. So if you exceed, it states in the standard, if you exceed the permissible exposure limits, you now have to regulate that specific area in which there are potential exposures. So you have to demarc the area and put in a sign and let individual knows that that unauthorized individual cannot come in here. And if you are coming here, you have to wear the proper personal protective equipment. So that was added and different than anything previously they had with regards to Silica. Also, there is a methods of compliance. So not only are we going to be just talking about the use of respirators, the standard requires if you're above the action level or above the permissible exposure limits, you have to implement engineering and work practice controls to reduce exposures to those individuals. And with that, they require a written exposure control plan. And what the written exposure control plan is, it's each individual task that's going to be performed has to be described along with what controls are going to be used, what house countermeasures are going to be used, and what respiratory protection is going to be used. So you're not just going to have one written exposure control plan unless it's only one task that's involved Silica. But if there's various tasks, you're going to have various written exposure control plans, and maybe even the same task, but within different environments. So for instance, if you have a fabrication worker, they may be cutting it inside the facility, and you have a written exposure control plan associated with the work done in the facility, but maybe they go to the residential home where they're going to be putting in the new stone top in someone's kitchen, but they've got to cut and maybe grind, polish, and do a little bit more work. You're going to have another written exposure control plan for that. So it's something that employers must do, and they've got to implement the use of it, and it's got to be reviewed yearly and make it available to individuals. So they're thinking about, to me, this is kind of like if you think about construction, this is a job hazard analysis, looking at the issue and making sure that you are making it specific to the situation in which the work is being done, rather than just we're going to use local exhaust ventilation. It's more specific on what's going to be done for that specific work task. And it's very important, and it's very spelled out in the standard that the use of exposure controls are necessary when you're dealing with Silica. So as we know, we have this hierarchy of controls in industrial hygiene where we begin with engineering controls. The most, I mean, there are other ones, isolation, substitution. Let's pretend like we can't get rid of the Silica. It's in the concrete, or it's in this granite piece of material. It's going to be there. So we want to look at the engineering controls. How are we going to reduce exposures? Are we using wet methods, so we don't allow for that Silica dust to become airborne? Are we going to use local exhaust? What are we doing? Work practices, maybe we're reducing the amount of work that individual can do because we know that there's high Silica exposures. As well as at the end, the personal protective equipment, the use of respirators is very important. So we want to start with the higher controls, and then as necessary, the use of respirators as our last line of defense. And again, something different from general industry versus the construction is that in the construction standard, again, they have that nice table for you that outlines what PPE is supposed to be worn during certain situations. They pretty much, tell you what you have to use when you're doing the general industry and performing your own assessment or objective data. You have to use the calculated information or air monitoring data that you have available to dictate the specific respiratory protection that will be required for the individuals. And along with the standard is housekeeping, which is also another important part of it, because we know it's really fine particulate, and housekeeping is very important because there is a really low exposure limit. So if you're not cleaning facilities properly, you can cause additional exposures to individuals. So in the standard, they do not allow the use of dry sweeping or dry brushing in areas where silica dust is being created or present, unless there's no feasible reason for it. They don't allow for compressed air to be used to clean clothing or surfaces. Again, ways that you can make this dust become airborne. That is not allowed. And they recommend other uses unless there's no feasibility to it. And medical surveillance is also a requirement. So if a person is exposed to silica at or above the action level for more than 30 days in 1 year, the employer has to make medical surveillance available at no cost to the employee. So it has to be offered at the initial examination. Sorry, the initial examination has to be offered within 30 days of employment. So you need that chest x-ray to kind of look at what is going on with the individual themselves. And then every 3 years, they have to go back in with the medical surveillance program, get their chest x-ray, perform the physical exam, the pulmonary function test. Again, remember I said in the health effects that they're more prone to tuberculosis. So the medical surveillance program also requires that the individuals are tested for TB. So it's probably one of the more stringent of medical surveillances I've seen with OSHA. We have asbestos where they do require, the annual chest x-rays and lead for testing. But this one was probably one of the more stringent ones I've seen, again, asking for the TB test. So it's very important. So the whole goal is we want to reduce exposures to individuals so that we're not hitting this action level, so we're not having to put people into medical surveillance programs because it's costly, it's timely, and we know it requires a lot of employers and employees. So goal is here to reduce exposures to the extent possible. And additional items is the record keeping. You have to make sure that you keep all the air monitoring data that you've collected or to date, and that outlines, what was the task that the sample was collected during, what are the analytical methods. The standard specifically talks about sampling and laboratory requirements are associated with the standard. So you can't just use a new lab. It has to have a specific detection limit and use specific analytical methods. If you're going to use objective data, you've got to make sure that you are also keeping that. And so that you can show someone, this is, if we're not collecting our own samples, here's the data we're using in order to characterize your exposure. So what was their testing protocols that where you got the objective data from? What is the source of the data? Any of the other relevant information that kind of puts your situation similar to the situation of the data that you are using. And you've got to keep all of your medical surveillance data information as well, which is the medical written opinions of the health professionals. And so just to wrap it up again, I found this nice table that kind of outlines it very nicely. So what are the requirements from the standard? There's air monitoring requirements. If you hit above the permissible exposure limit or an action level, what do you have to do? You've got to do monitoring every 3 months if it's above the permissible exposure limits, every 6 months if it's between the action level and the PEL. Regulated areas, if you're above the PEL, you've got to start putting in signage at all times in areas where people may be exposed to silica above this permissible exposure limit. You've got to develop exposure control methodologies and providing those in writing, and train employees. You've got to do the medical surveillance and make sure that any individual who may be exposed to levels of silica above the action level more than 30 days, that they have the chest x-ray, the lung function test, and the TB test. And so that's within 30 days for your initial examination and every 3 years after the fact. So very specific on it. So now let's go into the fun stuff, the case studies. FACS has done a lot of projects with silica, and so I wanted to highlight some of, again, the more interesting ones that kind of highlight when you introduce controls, what you get from it. As I say, we've done ones with ceramics departments where we found low levels, nothing really above exposure limits. So I'm just going to kind of go on ones that found significant exposures. So the first case study is at a fabrication facility. Our purpose was to evaluate silica exposure of employees, and they also wanted us to evaluate the effectiveness of their engineering controls because they already had ones in place. Within this project, the employees were cutting, grinding, and polishing marble and granite bench tops, and they used both dry methods and wet methods. And the controls that they had, as I stated, were they had a local exhaust ventilation system, and they had employees are wearing respirators. So here are some of the photos from it where you see the wet methods being used, as well as the all the different local exhausts that was associated with the project. So we have the individual, if you see on this far right, he's doing work on this granite top, but as you see in this dry operation, he doesn't have wet methods associated with his work. But as you see, his local exhaust is pointed in a different direction. It's not even near the area in which he's doing any work. So when we collected our samples, we looked at there was 3 different individuals, 2 in the dry operation side and 1 on the wet side. And what the results found is that the 2 individuals who were working on the dry side operations exceeded both the action level as well as the permissible exposure limit. And the individual on the wet side did not exceed either. So as you see, when you use wet methods where you are adding water to the system while you're cutting, reduces the generation of the airborne dust, and we didn't necessarily get that exposure anymore, or exposure that exceeded anything. And so what we concluded was that we have these 2 individuals with these high exposures, and now these individuals are required to wear the respiratory protection that they were already wearing. And we calculated what would be the assigned protection factor. So that was a 5 or greater. And now that we've exceeded this permissible exposure limit, they have to comply with a lot of the silica standard requirements, which is, again, that written exposure control plan, demarcating and regulating areas, repeating the exposure monitoring every quarterly, and medical surveillance, record keeping, and implementation of work controls. And that's just specific to exceeding that. But our observations, because we don't want to just collect the sample and say, here it is, we are obviously observing the work practices and the space while we're out there. And we, again, saw the individuals not really using the local exhaust ventilation system as it was meant to be. They're not putting it in an area that would pull the dust from the work area before it got into their breathing zone. It was moved to different areas. So we recommended that definitely they need to train their employees on how to adequately use this local exhaust ventilation. Just looking at the general cleanliness of the facility, even in their break room, as we saw high levels of dust. Some individuals who were wearing the respirators were not even clean shaven. They had facial hair, which we know can reduce the seal and potentially expose individuals even more. And ensure employees clean any clothing worn during the shift prior to taking breaks. So they would get dusty, especially on the dry operation side, and then go in and take a break and still not, clean themselves. And so if they pick up the dust on their clothing, they can potentially expose a little bit further. We were asked to come back after that report because the facility obviously was trying really hard to reduce these exposures. So they went and installed even more local exhaust ventilation. So if you see in this photo, they've got these automatic cleaning dry shop dust collectors that they put on one wall along the dry work area. And so we reevaluated 3 employees again, 2 on the dry side and 1 on the wet side. And from our assessment, we identified that housekeeping measures improved greatly. So we saw not levels of dust as we previously saw during the first assessment. However, despite the new local exhaust ventilation that they introduced, we still had 1 of the 2 employees on the dry side exceed the PEL, but the other one now only exceeded the action level, and the person on the wet side still was below both the PEL and action level. And so from our assessment, we kind of looked into it a little bit further, and yes, they installed this nice, expensive new system. We were still seeing that the workers really weren't understanding the concepts of how it worked and how to protect themselves by using this system. So they weren't really situating the work to remove the dust. So that was one of our big recommendations was, again, you need to educate and train these individuals to use the local exhaust and the manner it was supposed to be used. The next is a very interesting one. It's sandblasting, and we performed an assessment of an individual who was inscribing and abrasive blasting headstones for a cemetery. So this individual would do this for about 4 hours a day, just go into this sandblasting room and just go at it for about 4 hours. So we were asked to evaluate their exposure. This individual already wears respiratory protection, as you see here in the photos. And he has 2 different levels, one for when he does the sandblasting and inscribing inside. However, there's a lot of dust being generated. So at times he would wear the smaller half-face respirator to just other lower dust generating projects. So this was observed to be a very dusty project. If you see on the lower left, there's a lot of dust coming out from the room in which work was being performed. So it wasn't a completely sealed room. And what we found with this individual was really high exposures as well, as you would assume, just by looking at the amount of dust that was observed. This individual exceeded both the permissible exposure limit and the action level during this type of work. And we did some area samples, one outside because we knew it wasn't completely sealed, as well as one just in the room itself, the blasting room. And luckily outside the room, even though we saw the dust coming out, we didn't get any high exposures. There was no measurable levels identified, but definitely really high exposures in the room itself. And from that, we recommended, again, that they have to continue the use of respiratory protection. His exposure was a little bit higher, so we recommended a assigned protection factor of 10 or greater. We also recommend by just visual observations that when the individual was dumping dust from a dust collector, they were doing it without respiratory protection and just throwing it into a large trash collector where a lot of airborne dust was being generated. So that's another potential exposure. So we recommended wearing a respirator when doing that type of work. We also were told that the individual sometimes dry sweep, so we made sure to comment that do not dry sweep. And the individual didn't really store his respirators properly, so we made recommendations for that as well. And we oddly had another case that was similar, where someone was also doing the same thing, inscribing and abrasive blasting of headstones. However, in this project, all of this work was done in an enclosed system equipped with local exhaust. So instead of having the individual go into a room and do it themselves, it was all electronic within the system. So all of the sandblasting and the work was in this nice little enclosure, and the worker was outside the space. The worker only went inside to set up, prep, but none of the inscribing or abrasive blasting was ever occurring when the worker was inside. So using this type of isolation control, as you see here, significantly reduced exposure. So this individual did this work task and no measurable levels of silica were present. So that just shows you it's two of the similar work task or what you're trying to accomplish, the inscribing of headstones. But when you do it electronically and in a closed system, you have no exposures or insignificant exposures to the worker versus the high exposures when the individual is doing it themselves. So it was very, when I saw we did the first project with the individual working inside, and then when we saw this project, it was like, wow, what a big difference, and a way to protect an employee by kind of moving it and no longer allowing just an individual to do it, but doing it in a different manner. Another case study, a project you wouldn't think you would have high exposures to silica, and again, just outlines the importance of kind of understanding the industry, right, is a dental appliance laboratory. So we were asked to evaluate silica exposures because they knew that some of the materials that they work with when they're making models for teeth dental applications, some of these models contain up to 5% of crystalline silica in it. So we were asked to evaluate workers in the dental appliance lab. And we evaluated a dental assistant who made alginate impressions in dental model castings, a partials lead technician who created metal partials and impressions, and a crown and bridge model lead technician who created fixed dental implants. So he's did an exposure assessment for all the individuals. This was all done in one laboratory, and there was a lot of different local exhausts that was used. So they did some sandblasting, but as you see, it's in a closed system. They had local exhaust set up and a lot of the different applications that are necessary to get these dental models created. And we were surprised to see that one of the employees, and it looks alarming here because it says 36. The last results were in milligrams per cubic meter. This one's in micrograms, so that's why it looks a little bit higher. But one of the employees, the partial lead technician, exceeded the action level, which was very surprising to us. So when we kind of looked more into it, we kind of evaluated a little bit further and saw that a lot of the employees that were working in the area, it was kind of there was not a lot of good housekeeping measures is what we kind of saw. So we recommended, again, this person now has to this individual, as well as anybody who works in the same type of work practices or activities, has to be involved with the silica standard. And we've got to put the silica standard requirements with the employer. So developing these written exposure control plans and medical surveillance, because this was an individual who will do this for more than 30 days of the year. And one of the biggest things we saw was the increased housekeeping efforts that we thought were necessary. So we saw these levels of dust that we thought if they maybe increase our housekeeping measures, that might help reduce exposures to the individual. And so all of these were really important to kind of highlight that, one, you can't just assume that someone's not exposed to silica. You really have to look at safety data sheets and the way they're doing works and evaluate. And also the importance of the use of controls to reduce exposure. So stopping and thinking, someone doesn't have to be exposed to silica. There are ways we can reduce that, and continually thinking about that, implementing wet methods or local exhaust. And then once you've done that, continue to reevaluate to try to reduce exposures even below and even further below action levels. We want, in a perfect world, no measurable levels of silica. And so that is the end of my presentation. Do we have any questions?
We do. Thanks, Michelle. First one is, what do you see as the differences between the OSHA standard versus the Mine Safety and Health Administration standard? Are they similar and based on industry, construction, general industry versus mining? And has FACTS performed any mining operation evaluations?
I myself haven't. We have a coworker who's on who is big in the mining industry in her past job. So I really haven't looked too much into it. I just barely a little bit, and it's very similar. They have a really high potential exposure, so it really goes into similarly the same type of engineering controls but thinking about working in a mine and what you have access to as compared to if you're in a facility and you've got a lot of electrical outlets and local exhaust ventilation that you could use.
Okay.
But yeah, so it's a little bit different and written a little bit differently, but it's definitely a high emphasis on control of exposures.
Great. And the next question was, what are the options for on-site testing?
For exposure assessment or medical surveillance. So exposure assessments would be, again, performing, having your pump with your filter and collecting the data.
And for this case, actually, we just got a little clarification. It's for a stone fabrication facility, is the person that asked that.
So what are your options for assessment? Can you repeat the question?
What are their options for on-site testing?
So yeah, it would definitely be hiring an industrial hygienist to come out and evaluate, similar to what we did, where you would be putting pumps on individuals. And again, not just connecting it to a filter, you have to make sure to filter out the larger particulates. So you need certain sampling equipment like a cyclone that will just measure the respirable dust, and then putting that on individuals and watching them throughout the workday. When you're doing the wet methods, you have a potential of moisture getting into the pump. So there's different ways that we kind of come up with to try to still get good data without causing issues to the sampling equipment itself. So there's new things called parallel particle impactors that work really well, and OSHA actually states that it can be used to evaluate silica exposure, which is really important because it's a lot better than the cyclone. Cyclone's a little old school, but yeah, there's a lot of different methods. But what's very important is not just collecting a sample and looking at the data. Like I said, when we did the first fabrication facility, we identified that they're not even using their local exhaust properly. So that's the first step. We need to try to reduce exposure if we're just watching what they're doing and trying to help them come up with work practices to reduce their exposure to the extent possible.
Okay, and they just clarified too, they're a wet method, like you mentioned.
Yeah, so yes, definitely. It's you can still perform an exposure assessment with a wet method, but it makes things a little bit more difficult, and you're definitely watching the individuals closely so that you're not cross-contaminating. And sometimes we'll even do shorter time frames, so you wouldn't do a full 8-hour sample. You can maybe do 4 hours, so that you can get at least some data from it.
Okay. And the next question, can an employer conduct their own risk assessment?
Yes, they can. They just have to follow the standard. If they're going to perform their own sampling, again, they just have to make sure that they have a qualified individual, maybe someone who is in health and safety or EHS from their facility to do the assessment. You don't have to hire a consultant. When you do hire a consultant, obviously you get their expertise of not only that specific company, but working with several other companies, so you can provide recommendations for them. But yes, you can, as long as you follow the specific sampling and laboratory methodologies called out in the standard.
Okay. Next question is, using compressed air to clean items after sandblasting is a common tool. Is this allowed?
It is very common, and you see it a lot. And again, the standard calls out once you hit an action level that they do not want you to do it. But there are times, and they say to the extent feasible, do not use it. So that kind of gives you, that's a gray area, right? But we highly recommend that's not used. And if it's used in a manner that reduces exposure. So maybe you are using compressed air after sandblasting to clean an instrument. So maybe you could do that inside the sandblasting where the local exhaust is, or finding another local exhaust. So whatever you're shooting off the instrument is being collected within the local exhaust system, so you're not being exposed to it. So if you have to use it because there's no other option, you be smart about it so that you're reducing exposures.
Okay, and we just got another question, and I'm going to do my best to recite this, but I am not a scientist. Do you think it's realistic for California OEHHA to set their chronic inhalation REL to UG/M3?
What's the number before? Yeah, that's micrograms per cubic meter, but what was the value?
3.
3. Oh, that's hard. I mean, but OEHA already, that's OEHH. OEHA already has really low numbers. And I don't think they, like OSHA, they come up with whether it's practical or feasible. It's kind of like when you look at NIOSH for formaldehyde, the exposure, their level is 0.0016. It's just, their idea is it's bad and to continue reducing exposures to the level you can. So they're not taking in feasibility at all. But the point is it's bad. It causes cancer and debilitating things. So even, like I said, even when we're below action levels, we always want to be thinking, how do we reduce exposures? Sure. If I see something, regardless, I'm always going to provide a recommendation. So 3 microgram is very low, but.
In the second question to that initial question was, what sampling method would you use to test for such low levels of exposure like that?
Oh man, yeah, you would have to, I would have to look, and I don't know what the detection limit, and I probably, oh my gosh, can I go back to this? Can I go back a second?
Sure.
We have a moment, right? Let me see how low our detection limit got in some of these. Let me see. Yeah, well, yeah, that would be hard because look right here, we have 4.3 micrograms. And that was a really long sampling duration. Yeah, you would have to. So the PPIs that I was speaking of. So when you use a cyclone, I think the highest is, if you use an aluminum cyclone, you can get 2.5 liters per minute. And if you sample, and I think that was with the cyclone, if you sample for 500 minutes, you can only get to 4.3. The PPIs have a specific PPI that will allow you to do 8 liters per minute, which would give you a higher volume, which would probably allow you to get to that detection limit. But as you know, if there's any dust, 8 liters per minute, you'll probably overload your sample. So point being, it's probably going to be very difficult. It's probably going to be very difficult to get to that unless laboratories get better, and they already do a great job, but probably would have to get better in their detection limits.
Okay. And then Madeline Dangazian out of our LA office, another one of our CIHs that works with Michelle, mentioned in the chat, longer duration sampling to lower DL, or with PPI, higher flow rates.
Yes, exactly.
Feels like I'm speaking a different language, but thank you, Madeline. And then we've got just one more minute left. We'll do this last question here. Are any of the silica standards risk or health-based in our regulations, or something different?
They are risk and health-based, but obviously the OEHA are more health-based. These take into consideration general industry or all industry and what they can accomplish. So whenever they have a new standard that comes out, they put it up for public review, and then the industry comes and says, we can't do that. That would cost us $800 million. That's just not feasible. So that's why regulations are nice to have, but they're really not always specific to health-based and exposure issues. There's politics associated with it. So, but it's nice. It's a lot better than it was. So, I mean, it's not perfect, but it's a lot better. And again, like I said, Cal OSHA already had pretty low limits and specific, but when you looked at federal OSHA, you could get a lot higher exposures because of the way that they did their calculations.
Progress. Well, that is we're right on the hour right now, so I want to respect everybody's time, but thank you all for joining us for today's presentation. We'll also be sending out Michelle's contact information along with a link to the recording of today's presentation if you want to reference any of the material or have any follow-up questions for Michelle or any of the material that she covered today. So thank you again, and have a great rest of your day, everyone. Take care.